Hi, this is Dr.Supriya. Now let's get into the second part of female genital tract, which includes fallopian tubes, ovaries and pelvis. Coming to fallopian tubes, there are two slender conveyor tubes attached to the upper end or corner of the uterus. They literally convey the sperms to the spot of union with the ovum in their ampullary part. And again, they convey the newly fertilized egg, that is zygote, to the womb or uterus. They also case the ovary and picks up the ovum when it is released. Now coming to the ovaries manufactures the eggs. There are two ovaries in relation to the two fallopian tubes. The ovaries secretes several hormones and are the prime endocrine glands of reproduction. They also respond to the other endocrine glands in the body, such as pituitary and hypothalamus lodged in the brain. The ovum or egg is the largest cell in the body of 0.8 mm in diameter. It is the only single cell that can be seen with the naked eye. Usually, one ovum is released in every menstrual cycle. If the ovum gets fertilized and implanted, the ovary becomes quiescent till the variable period of time after delivery. In the first 3 months of pregnancy, the ovaries release large amounts of progesterone to support the newly formed chorion. It is the early placenta. Later in the 4th month, this function is taken by the placenta itself. Now coming to the bony or skeletal structure, that is pelvis, which is also known as a hip bone. It is attached to the spine by the sacral vertebrae. The sacral vertebrae is usually a fusion of 5 vertebrae. The shape of the sacrum determines the capacity of mid-cavity of the pelvis. If it has the good frontal halo, the space expands. If it is flat, the space reduces and the space available for the fetal head to rotate becomes narrow. The first sacral vertebrae is also significant. If it protrudes too much into the pelvic cavity, it reduces the anteroposterior diameter of the pelvis. Now, the fetal head cannot enter the pelvis. The pelvic cavity through which the fetal head must pass has the pelvic inlet, mid-cavity and the outlet. It is curved forwards in relation to the spine in supine position. The hip bone is again a fusion of 3 separate bones, the ilium, pubis and ischium. The pelvic inlet has various shapes and according to the diameters, it is classified as gynecoid pelvis, it is typically female pelvis, android pelvis, it is typically male pelvis, anthropoid pelvis, it is typically an animal-like pelvis, platypaloid pelvis, it is a flat pelvis. Obviously, the gynecoid pelvis is most conducive to the normal delivery. It encourages the fetal head to engage in correct position. Android pelvis, which is typically a male pelvis, allows the fetal head if it's of a reasonable size. But because of the bony prominences called spines at the mid-pelvis, it causes the arrest of rotation of fetal head. Now, anthropoid pelvis, which is typically an animal-like pelvis, it is also hospitable to the fetal head, but it encourages the posterior positions for the head. So, the labor can be prolonged. Now, the platypoid pelvis, which is the flat pelvis, unless they are very big, discourages the head from entering into the pelvis. As we finished female genital tract, now let's discuss male genital tract in the next episode.